Hey guys, so here's today's COVID update. Um, I've been getting my data from this dashboard, the COVID dashboard that's available on the Department of Health website, and it's not the greatest. First of all, it doesn't really work on mobile. Um, Actually, here, let me show you what it looks like on mobile. So that's what it looks like on mobile on my phone. It's not really responsive. Um, That's on the iPhone, like on the iPad. This middle section here gets like, I don't know, gets shrunk. And then, like the graphs and stuff are not easily readable. But anyway, yeah, so it's not the greatest, but whatever. Uh, so basically yesterday, we had over 100. We went over 100 cases, and today we're at 89. And I think we had, what was it, one death? Can't remember. They don't really show like the death, that the fatalities by day. So you kind of have to look at what the death was yesterday. And it's not really up to date. Like they don't update it. There's some gaps in the updates. Um, so I was wondering, like, where can I get more? Where can I get better information? About if I'm gonna keep track of what's going on with COVID. So I kind of like was looking around. This site is really good. So this is the Hawaii Data Collaborative. Let's make it bigger here. So they have a bunch of data. They present it in a kind of a nicer way. Um, and then they have other websites that you can go for information. Now I'm assuming they're getting the information from the same place. Like there's some central repository for all of this information, so that the numbers are not different. Um, but it is, right? It is different because here it says 87. This is the 7 day average, right? 7 day average right down here. And then it says state is 87. Like on COVID POW, it says 88. And this is as of November 9th. So I'm assuming they update it, but I don't know. I'm assuming this is a screenshot. I don't know, but it's just weird that they show this here and not update it. But one thing that I did find, which was kind of interesting, where is it? Is like somebody created a Google Doc that has all of the information, like all of the case information. So if you wanted to, if you're a spreadsheet fanatic, which I'm not, if you're pretty good with spreadsheets, you can kind of make your own graphs and stuff. It's got a whole bunch of information in it. This is the Hawaii pandemic applied modeling. They do like forecasts, and if you scroll down, I mean, there's a whole bunch of good information on here. They have a place where you can get the information. So input data sources. Uh, if you click on like daily cases, let's pull this guy up. It brings up a Google Doc spreadsheet, which is kind of neat. And so it's got the case numbers from March 6th of this year. And it's got a whole bunch of other information. I don't really know exactly what uh, each of these fields mean. So here's the, how do you resize? I don't know if you can resize. This is not resizing. But anyway, 7 cases. I'm assuming that's the 7 day average. They have some recovered information, hospitalized information, death totals. So this as far back when it first started in March, when they started tracking this information, they didn't have the death totals. Um, but you can kind of see like the numbers start getting populated down here with the first death being March 31st, right? So if you're a spreadsheet whiz, you can go ahead and create your own graphs and do maybe your own analysis on it. But it's got, you know, like the total cases, total new cases a day, and and it's broken down by the counties, right? They even have like outside of Hawaii, which is pretty cool. So I might start using this. I don't know if they update it every day. You would have to like access it every day to if you want the latest information. But at least that way, like you don't need to like keep your own spreadsheet. Some people are creating their own spreadsheets and then like logging in the data every day from the news or whatever. This thing is already here. So that's, I don't know, you might as well use it, right? I'm assuming, and this is an assumption, I don't, and you know how assumptions go. I'm assuming this is accurate data. Um, you know, it's from the Hawaii Data Collaborative folks, and um, yeah. To me, if everybody's working off of the same set of data, and they're making, uh, you know, they're doing analysis, and everybody's looking for different things. But if the data set is the same, then at least we're all kind of talking about the same thing. So yeah, I mean, I thought this was kind of neat. So I'll probably be using this. This is again, you can find this link on the Hawaii Pandemic website. It's hipam.org. And if you just scroll down to input data sources, they have a whole bunch of links where you can get like raw data, right? Like that's kind of what we all want. We want the raw data. Because again, like this dashboard is not really, it's not really that useful. I mean, it's, I guess it's okay. I mean, at least it gives you like the daily total, like the new cases. It gives you the positivity rate and stuff. But other than that, other than these like 9 boxes, that's pretty much it. And you know, I don't know. I'm kind of like I'm interested, like what's going on in Finland, like what's going on in Kauai. So, you know, having things broken out is nice. The other thing that I'm really interested in too is the outbreaks, right? The clusters. And at one point, the Department of Health was putting out, they had a dashboard as well for the contact tracing. And then that kind of mysteriously disappeared. And in fact, the whole dashboard thing has gone through several changes, maybe 4 or 5 different changes. Um, and the amount and the information you got was different. So that's kind of an adjustment period. Every time it changes, you know, you kind of, oh, what's going on? Like, you know, what does the data mean? Or how can I, you know, where's that piece of information that I was, you know, getting before? It's no longer available. Well, you kind of have to dig around. But if you dig around, you can find some pretty good stuff. So um, there's a PDF that's produced, I believe it's produced every day, that shows the contact tracing information. And so this was something that they had a dashboard for before, um, and then it kind of disappeared. So we were always wondering, like, hey, where's all the clusters coming from? Where are all the new cases coming from? And that's important. And I'll kind of show you why here, you know, in just a few seconds here. The the importance of where the clusters are and what it means to us as a community, right? So I don't know if you guys been following the so the numbers kind of go up and down and goes up above 100, below 100. Sometimes it goes down like a lot. Um, Usually when it goes up a lot, it's because of a cluster, right? Uh, so like the correctional facilities, it's like a huge number of people, right? And there's only two clusters, so there's only two places where they're having these outbreaks, and it's like 817 cases. Yeah, and this is as of December 10th. The schools, there's three clusters that account for four cases. Um, I'm assuming shelters like the homeless shelters or whatever. Um, so it's kind of neat that they actually do break this down. It would be great if the news or if the government actually would tell us specifically, like, I don't know if it's a great idea to tell us like, specifically like, what business or what uh, where exactly, but like at least generally, like the general area where these things are popping up. So you know you kind of have a heads up whether or not you want to go to that area or not. Especially like restaurants. Like restaurants, definitely they should publish um, where like which restaurants we're having these outbreaks because restaurants are open, right? Like you can dine in now. Uh, but even more so, even if you're not dining in, if there's an outbreak at a restaurant and you're ordering from them, um, you kind of would want to know that because again, like a lot of people think, this whole push with the face masks, uh, that prevents you from spreading the virus through the particles that come out of your mouth, right? Um, but you can still touch things. Like we're not wearing gloves, so you can still touch things and you know spread things that way, right? So like if somebody's preparing the food, I don't know, you probably get it from them, handling the food and stuff, even if they're wearing a mask. And that assumes that people are going to wear the mask all the time, right? Like if they're working, they're wearing the mask all the time. But like people take breaks or they might be sweating or whatever, and they take off the mask, they kind of wipe their face, um, and then they start touching things. So just knowing where these clusters are coming from is kind of important for me personally. Like, and I don't really go anywhere. I'm trying to stay away because to me that's the for sure way, right? I can wear a mask, yeah, that's great. I can do 6 feet distance, social distancing, that's great. But those things are guidelines, right? They're not necessarily guarantees to keep you safe, and we know that for a fact. Like 6 feet is definitely not enough to prevent the thing from spreading. So, um, like basically like staying away from gatherings of people or trying to limit your exposure to people who might be infected. Really, that's the only way to truly prevent yourself from catching it. Um, so yeah, I mean, this is kind of a neat breakdown from the contact tracing, and I know a lot of my friends were asking about the contact tracing information, and where was it? We're getting so little information from the media, from our government officials as far as contact tracing. But the information is there. They're collecting the information, and it's general information. It seems like this it's not really broken down. Although they do go into some explanation in this document. Um, like here, like And these are category explanations. Let's see. These are just like definitions of what these categories mean, right? So, like for example, shelters are facilities providing short or long-term sheltering services for individuals and groups without access to permanent housing. So it's kind of like, I guess like if there was an emergency, there you would have like Red Cross. They would set up like an emergency shelter that would be under there. But for the most part, I think it's mostly for like homeless people. Um, I thought there was a place where they kind of explained what was going on at some of these outbreaks. I can't really see this. My screen is so small. This is what I'm normally used to seeing, but I don't think it's readable. Yeah, I can't find it. But it'd be to me, it'd be great if they did kind of give you more explanation on, like this outbreak here at this correctional facility. Like, what happened? Like, what's going on over there? Uh, how are they getting it? Is it spread through the guards? Are the guards going home? Are they, like what steps are they taking to make sure like it, this thing is isolated and not spreading in the community? Um, I mean, that's kind of a lot, right? 817, that's like the vast majority. You have 41 in places of worship. Um, so yeah, I mean, so the information is there. You just have to dig around, man. It took me a while to dig around on the Department of Health website. I have this loud bird outside my house making a whole bunch of noise. But yeah, I just kind of wanted to share this. I don't know if you guys knew about this. This is kind of useful. The spreadsheet is definitely useful if you do want to kind of do your own modeling and forecasting. Some people I know on Facebook were doing that. Uh, but this is a good place for you to get your data, and you don't need to like go hunt around, especially if you like just starting now and you want like past data. It's all in here from March 6th all the way till today. So that's kind of cool. Another thing that kind of want to briefly go over, I was very interested. We're hearing a lot about the vaccine, and I had a lot of questions when I first heard about the vaccine, and oh, they're going to start distributing it. Well, I had a lot of questions about like what exactly is the vaccine? Why are so many people, myself included, uh, hesitant about getting it? And a lot of it is because we're not informed, right? We don't have the information. And I don't want to be injected with something if I don't know exactly what it is, like how effective it's going to be, um, what kind of protection it's going to give me. So I kind of found this neat article here on newscientist.com, and it kind of answered a lot of my questions. So, like we all know, like the Pfizer one is the first one that's approved by the FDA. It's 95% effective. It so the phase 3 trials, which is the like the big trial where they test it with a bunch of people, involve 42,000 people. But what we don't hear is that so when you do these kind of trials, you have to have a group of people that actually get the vaccine, and some people don't get the vaccine. They get a placebo, right? And then you need to compare to make sure like it really is the vaccine that's preventing the disease, these people from catching the disease. So it was half, right? So half of the people that would make it 21,000 got the vaccine, the actual vaccine, and 21,000 just got placebo. And then they had 170 people actually caught COVID out of the whole group, right? 42,170. But remember, like some people have the placebo, so they weren't really protected. Then it says only 8 of them were in the vaccine group, so that's great, right? Uh, so it seems like it's very effective. Uh, and then I was wondering, like, oh, what's in the vaccine? Like, what people are uh, concerned, like the vaccine might cause a reaction or get them sick or whatever. Kind of like the flu thing. They're actually injecting you with flu. Well, in this case, the main ingredient is the messenger RNA, which they call mRNA. Um, and like your DNA and your RNA are little pieces of, I think it's like proteins that are like encoded, right? They have like different combinations and they do different things. They're like instruction sets for your body, and uh, that's that's what's supposed to stimulate your immune system and protect you from getting sick, should you encounter the virus, the COVID-19 virus. So it's a synthetic, which I thought was kind of interesting. It's a synthetic RNA or mRNA. It's not actually extracted from the virus. So they're not giving you the virus. They're giving you a specific part that's synthetically created to simulate the virus in your body, and then your body kind of thinks it's in danger, and then the immune system kicks in. So that's that was kind of good to know. Uh, how long does the immunity last? So that's kind of the big thing for me, right? Because like the flu, so flu is seasonal, uh, but you can get the flu any time of the year. It's just that most of the time during the colder parts of the year, that's when you have the most cases of flu. So the flu shot is uh, effective for 6 months, right? So you're not protected for the whole year, but we only get the flu shot once a year because it's seasonal. Well, COVID is not seasonal, right? COVID is year round as well. You can catch it anytime. So the interesting thing is that the these these pharmaceutical companies who create these vaccine, uh, either they don't have the data, or that's it seems like it wasn't even important um, to determine like what the length of time that you're going to be immune for after getting vaccinated. and and that makes sense, right? You kind of want to just curb the spread and lessen of death or severe reactions to the disease. Um, but I think long term wise, like, yeah, we need to figure out, like, are we going to have to get a shot uh, every year, every 6 months, every month? I don't know, right? And for the Pfizer vaccine, you get 2 shots, right? So you get 1 shot, and then like 21 days later, you get another shot, and then um, that's when you develop the full immunity. So it takes, like 3 weeks for the whole process uh, of getting vaccinated. Then and then I don't know. Let's say you're immune for 6 months. So that's 7 months out of the out of the year. You have this. Well, you're always going to have that 1 month buffer, or that not even a buffer, it's kind of a 1 month period where you're just not going to be immune, right? Because you just if and I don't know how this is going to work. There, some people are saying you'll be immune indefinitely at that point. Some people are saying that you might need a booster every year, once a year, but we don't know because nobody knows how long the immunity is going to last. And hopefully it lasts like 6 months. That to me that would be great. But I really don't want to get 2 shots like every year plus the flu shot, right? That's 3 shots every year. Mm, yeah, I don't know that, but that's something that um, we weren't told. Like and that goes into your decision making, knowing this kind of stuff. So again, here's the part where it's a 2 shot vaccine. Now there's another company that's coming out, right? The Moderna vaccine. I don't know if that's 2 shots. If somebody knows, you can let me know. Um, but the Pfizer vaccine is 2 shots. So um, you need the 2 shots to get the full effectiveness of the vaccination. Side effects, they were very minimal. I mean, some like a very small percentage had really bad adverse reaction to the vaccine or what they think was caused by the vaccine. Again, we're going to find out. I haven't heard anything coming out of the UK, and they've already started vaccinating people with the Pfizer vaccine. So, I mean, we'll find out, right? But I mean, again, because this thing was because the vaccines were fast tracked, normally it takes multiple years, and they'll find these things out over multiple years, right? Well, in this case, it got fast tracked in less than a year. So there's a difference between it working in the lab. There's a difference between it working a small group of people, but when you are distributing it to tens, hundreds of millions of people, uh, we're all living differently, right? There's different conditions in our life. We're all we all have different health states. Some of us might be on medication. Some of us have different types of allergies. Um, we don't know um, how everybody's going to react. So I think that accounts for a lot of people being kind of hesitant um, taking the vaccine. It works great so far as we know, on the elderly, and in the UK, they were actually prioritizing giving it to the elderly first. I would think that would be kind of the same thing in America. But yeah, does it protect everyone? No. In the trials, about 20,000 people who were giving the vaccine, 8 caught COVID-19, and 1 became seriously ill. But in contrast, 164 who got the placebo, they got uh, COVID. So, you know, to me, that's pretty good, right? Except if you're one of those few people that it doesn't protect, then it sucks. Uh, so this is kind of the other thing that a lot of people, and me included, had a question about. So you get vaccinated, uh, you don't get sick. Okay, you get vaccinated, you're fine. You don't get sick. People are coughing on you, sneezing on you, spitting in your face, and you're fine. You're you know brushing it off. Oh, no problem. Uh, can you still carry the disease? I don't know. We don't know. You could still be carrying it, right? You could catch it, not get sick, which would make you basically asymptomatic, which is what a lot of people are, right? Even now without the vaccine, they're just asymptomatic and they're just going around and you can spread it. So I don't know. I don't know. that's a big question. And long term wise, because some people are just not going to get vaccinated. Right? We just have to admit that. Like, unless it's they make it illegal for you not, like you have to do it, or else they'll, I don't know, fine you or throw you in jail or something. uh, some people are just not going to get vaccinated. Um, and some of us are going to be like, well, if they're not going to get vaccinated, then like if they get it, then they get it, right? Uh, well, that's a lot. That could still be a lot of people, and that could be people that we care about, right? And there's a lot of reasons why people would get vaccinated and not get vaccinated. You get religious beliefs and stuff like that. Um, I think that would still mean that we would have to take a lot of precautions, even if the vast majority of us are vaccinated, uh, to protect those people, and they deserve to be protected, right? I mean, um, yeah, it's a risk. That's a risk that they're taking, but I don't know. I mean, right? Like it's kind of like the AIDS thing, right? Like there were cases where knowingly having AIDS and they were going around and like having sex with other people. Uh, so do we now have to determine who got vaccinated and who did vaccinated? And let's say like you're out, I don't know, like dating. You got vaccinated, the other person didn't get vaccinated. Now what? You know? Um, or are they going to start discriminating? Like, let's say, someone wants to be a teacher, but they, for whatever reason, don't want to get vaccinated. Now they can't teach, right? Or they won't be hired for a job or something like that. I think that brings up a lot of questions, and I have no idea how they're going to handle that. But anyway, yeah, I thought it's a good read. Check it out. It's on New Scientist. This article came out, I think, earlier this month. Yeah, December 3rd. And there's some other website. I think New York Times just released some information. I kind of like going to the scientific type websites, because the regular news sites kind of dumb it down, and I kind of want to get as much information as possible. But yeah, if you're kind of hesitant about it, like nothing, makes you feel better or more confident about your decision than more information. So anyway, I think that's it for today's COVID update. I'm hoping the numbers stay below 100. It doesn't look like we're anywhere near tier 3 yet. Let's see, was it HiPAM that had the tier level? Here we go. So our 7-day average is in the 80s, right? So we're kind of still in the middle of tier 2. So in order for us to get to tier 3, like we have to drop below 50 for the 7-day average. And that doesn't look like it's going to happen anytime soon. Oh, also, like if you guys are interested, I've been following what's going on in California, and California is like a huge hot spot right now. They instituted a lockdown. This is what it looks like. I mean, this is crazy. Like look at this. So they had a like a little spike kind of in the summer, and then it kind of went back down, but you're still talking like thousands, right? And then all of a sudden, I mean, what is it? Mid-November. Jeez, look at that spike. Like almost 30,000, over 30,000 cases in a day. That's that's nuts. So, yeah, I mean, Yeah, that's I don't know what they're gonna do over there. And they're saying the worst is still to come with the holiday season. Uh, and in fact, like the football games, right? Like UH, they had to relocate some of the games they were playing California teams. I think they weren't able to. California's not allowing sporting events, so they have to find another place to play. So I mean, there's still a lot that we have to get through. It's probably going to go through 2021, but you know, everybody stay safe, take care of themselves. Uh, Definitely, like if you don't need to go out and expose yourself to a bunch of people that you don't know, definitely do that. This Christmas is going to be really, really weird. I thought when I first heard about the stadium Christmas lights thing, I thought that's just dumb. Like who would do that? Uh, but as we get closer to Christmas, I'm like, there's like nothing going on. Like this Christmas is going to be the most uneventful Christmas I think I've ever experienced in my life, and it's sad. And it makes me think about, yeah, maybe I should go down and just drive through the stadium Christmas lights, at least to kind of get that feeling of Christmas. Um, yeah, I don't know. We'll see if I do. I'll post some video. There's some great videos already on YouTube. I was watching it and I was like, man, that looks pretty good actually. Uh, So yeah. Anyway, I'll let you guys know. Anyway, that's it for today's COVID update. Stay safe, and we'll see you tomorrow.